Hello, folks. I'm Dr. Fazil. I'm one of the internal medical specialists as well as kidney specialist. We call it a nephrologist. We are here today to talk about a very common problem we have known as allergies. Allergies are very common, and today I'm going to talk to you what are the common causes of allergies, what are the symptoms, how they can affect your life, and how you can do the little things to improve your health and impact of allergies in your daily life by doing certain things in your life, as well as when you should be seeking help. Again, ladies and gentlemen, thank you for watching Dr. Fazil TV show. This is November 2023 Dr. Fazil TV show. So again, the topic is allergies, right? So allergies are very common, and especially in Arizona, southwest Arizona, we have issues with allergies due to a lot of dust. Now, it doesn't matter that you're not going to have allergies in other part of the country or other part of the world. It depends on your immune system. Some people have a hyperimmune system, and they can react most aggressively than other people based on their genetic makeup and their immune system, as I said earlier. So, what are the symptoms of allergies, right? As we know, in the old days, people used to call it hay fever. It is also, it can present with, for example, runny nose. You can see on my back of my presentation. Yes, pollens are the most common cause of allergies from runny nose because you inhale air, but it can also be due to weeds, and molds, which are out there in the air. And unfortunately, as we know, since we cannot encapsulate ourselves inside a bubble, we have to deal with them as we are outside doing our day-to-day work, and there are those things that are out there as well. Now, we do remember the amount of those allergens, I call them allergens, gets worse or gets better in certain part of the year. Like in the spring season, we see them a lot more than, let's say, for example, a dry season, And as the trees start to grow or bloom, you can see that the number of pollens or the things you're allergic to from the trees, weeds and trees and molds, they start to rise in the air, and you start to inhale that to your nose, and it will cause symptoms of allergies. Now, the symptoms of allergies could be like runny nose, cough, sneezing, sometimes even itching on your skin. And believe me or not, you can also be allergic to sunlight, yes. So we call it the solar urticaria. So solar urticaria means, and you can see on the back side, it affects mostly the areas of your skin which are being exposed to sunlight. So not a very good thing to have a solar urticaria in Arizona. We know we are one of the sunniest state in the all part of the United States of America, or even in the world. We are almost sunny throughout the year. So if you do have solar urticaria, it's dealt differently. Then allergies can also present with joint pains, aches, fatigue, tiredness. Not necessary that you will have allergies in a typical fashion of runny nose, cough, sneezing. It can present with various other symptoms which cannot be explained by any other medical conditions. Sometimes we label it fibromyalgia, but it's not fibromyalgia. I mean, you can have fibromyalgia as well, but before we diagnose somebody as having another problem, we should make sure that it's not due to allergies. And as I said, allergies can present with not only classical symptoms of upper respiratory tract reaction, even for example, asthma. Now you can see here is the hologram of an airway right here. And then you can see the inhalers are coming in, the pollens are coming in, and the windpipe, the bronchus, we call it bronchus, constricts. And that's why we use inhalers to open it up. So, and there's a test to do, we call it like a pheno test. This is a machine where we can see amount of inflammation the airway have before and after the treatment. So that's a way to officially diagnose asthma. So asthma is also falls in the category of allergies. So mostly allergy immunologists can also be specialized in treating asthma. Asthma is very common in children, as you know that. So let's move on to what are the other sources of allergies. So we talked about, like, for example, things up in the air, and you can see in back of my presentation, pollens, trees, weeds, and grass. You can also get allergies from the food or pets, cats, dogs, horses, even dust mite. It's not a pet, obviously, but things which are common around you. So when somebody typically a patient present to me, for example, with a skin rash, and we think it is typically look like a wheel, and you can see on my backside. That is a classical histamine. Histamine is the chemical which is released in certain kind of allergies. Allergies are come in different flavor, different fashions. There are different kinds. I'm talking about the allergies which present right away, because there are allergies you can have like slow allergies. They can present in months and days and years. That's not very common, but they do exist, and I will leave that topic for allergy immunologists, specialists to talk about it. We're talking today is the most common cause of allergies, which are 80% out there, and asthma is one of them, right? So, what can we do about it, right? So first you have to make a diagnosis. Now, as I said, allergies could be from cats, pets, and dogs, and people sometimes say, hey, how can I have allergies from my cat? I have this cat for 10 years or 5 years. Well, the thing is, the things you have the most common exposure to, that's what you're going to get allergy from, right? Your allergy build over a period of time because you're being exposed to the same allergen over a period of time. So allergies get more common as you get more exposed to the same source, which is causing allergies. Then obviously, there's a various spectrum, high and lows. People fall in both range. Some people have very mild allergies. Some people have a lot of allergies to minor things. Even soaps, detergents, new clothes, new makeup, new jewelry, perfumes. That's why we ask our staff and medical professionals are not supposed to put perfume on, because you never know when you see a certain kind of patients, they might be allergic to that perfume. So that's one of the reasons medical professional that include providers, doctors, nurse practitioners, medical staff, we avoid them. We ask them to please avoid putting perfumes, because people could be allergic to those chemicals. Those chemicals are, you never know, are not safe anyway. I mean, you keep inhaling it, you might get another medical condition besides asthma as well. So avoid it, or use good quality perfumes. And obviously in different professions, the requirements are different. Like in medical profession, we see a lot of people who might have allergies, so we avoid that, right?
The Dr. Fazil Show is now available to view at home on Roku devices and YouTube. Catch up on your favorite episodes right on your phone, available on YouTube and the BioFamily Clinic app. The Dr. Fazil Show is available in many doctor offices across Yuma, Arizona. Pick up your free copy of Health Tips magazine, available throughout Yuma, Arizona, or read our digital version at healthtipsmagazine.com.
Now, let's move on to other things, like people can be allergic to food. I remember a patient which had allergies to everything, and as a matter of fact, she was exposed to freon gas, which was being leaked from air conditioner. And after finding multiple sources which could be causing allergies, we find out that it was from freon gas, which was slowly leaking from the air conditioner. So after the air conditioner was replaced, the allergies stopped to exist. Now, freon does not have any smell, so it's just like speculation. It was a speculation and it was true. So sometimes the diagnosis is not easy. So the good history is really important. Good history, and then examination, and then obviously other tests like skin tests. So for example, we call it Southwest Arizona skin test. Each part of the country or part of the world have different common allergies, and we can typically check them through skin tests. You can see in the back of my presentation today that how we do the skin test. We call it a prick test because we kind of poke the skin with certain antigens, and then we check against the reference point of histamine, and then we find out if it is positive or negative. And if it's positive, then if we can avoid that situation, for example, if it's a certain cats or certain pollens, then avoid that pollen so it does not cause allergic reaction, right? So this is how we treat allergies. That's prevention. The other thing is there's a website for pollens in your area. You can go on the website. You can Google search like pollen count or pollen density in the city where you're at. Put your zip code and then it will give you amount of pollen for that day or that week or that next month or previous days, so you can avoid getting out into the air or an environment in order to avoid exposure to the pollens or grass or weed, which might cause allergic reaction. So that's a prevention, right? Other thing you can do is put, things like close your windows at home, try to avoid the pollens coming directly into the place you stay most of the time. Air purifiers might help as well. So air purifier can help. The good air purifiers with ionizing radiation and stuff like that, they can cause better purification of air. That might help as well. And if you know if certain things that you're allergic to, like certain kind of soaps, detergents, if you figure that out, or if your provider have told you that you might be allergic to this thing, then get rid of that problem too, so you don't get constant allergic symptoms, right? And same goes for food, lobsters, cherries, nuts. These are the common things people are allergic to, but there might be some other things too. So we check for food allergies. The treatment for food allergy is prevention, actually. There's no treatment for that except prevention, right? So, and if you're very hyperallergic to allergic reactions, you should have an EpiPen with you all the time. Please have an EpiPen. That's my advice to you folks. Have EpiPen. It can save your life. You can be in the wrong place at the wrong time. You might be flying in the air. You might be in the middle of nowhere. And you can see in the back of my presentation how to do the EpiPen. It is a lifesaver. It's worth it. I know it's expensive, but not more expensive than your life or somebody's life or your children's life or your parents' life, or your life. So do get EpiPen, have it with you all the time if you are allergic to a lot of things. So how we treat it? Now let's go over the treatment. Treatment is again prevention. Second thing is immunotherapy. Immunotherapy is where you use injections, subcutaneous injections. We make a serum, we call it serum, based on your skin test, and then we inject over an extended period of time. We call it induction phase, where we produce induction. It goes fast, and then maintenance phase, where we keep it for a long time. So body gets used to, we retrain your immune system. The body gets used to how to react to allergens they are allergic to, and then the allergic symptoms gets less and less. And there's other ways to treat as well. Again, please ask your provider, but let me give you some advice. One thing was prevention, immunotherapy, but antihistamines like Benadryl, Claritin, those things can be used as well to reduce allergies. Now, do remember there's another medication known as Pepcid. Now, Pepcid, we have H1 receptors and H2 receptors. Histamine act on both. So H1 receptors are blockers are like Claritin and Benadryl, that helps. And H2 receptors are like Pepcid. Although it's used for heartburns and gastritis, but it can also be used for allergies. So good thing to know that, right? So Pepcid, antihistamines. There's another medication known as montelukast that can also be used for allergies, and that is also known as singular. One tablet a day will do the job. Or you can have combination of all those medications. But the better way would be to prevent or avoid or get immunotherapy, because that's a long-term treatment and would prevent your problems for a long period of time. So it depends on what your circumstances are or what resources you have. But all options are out there, so be aware of that. Now, there's something known as drops. Those drops are at this time not FDA approved in USA use. There's some lingual drops as well instead of shots. They are being used in Europe. Why in Europe, not here? I think the genetic makeup is slightly different. So in the US population, we have more allergic response, and sublingual drops are not as strong. So they're not approved yet. There are allergy tablets as well coming out, which are out there in the market, which you can use to reduce allergies instead of taking drops or pills, or drops or shots. You can take the pills as well. So I think the horizon is changing, the paradigm is changing. So, but at this time, we go with the evidence-based medicine. The treatment is, as we said, number one, prevention. Well, identification, prevention. Then obviously there are medications which can prevent the symptoms. If you have solar urticaria, if you're allergic to sunlight, that's a bad one, especially in Arizona, obviously. So you will have to put a long hat, long sleeves, avoid exposure to your skin, and sunscreen would not help, by the way, in solar urticaria, because it's a different kind of allergic reaction. So as asthma is also allergy, so you have to treat asthma with, again, it could be treated with biologicals as well as traditional medications like inhalers, which, open up the airway back to normal, or steroids. Steroids is another treatment, which is anti-inflammation. But remember, allergy is an inflammation. So anti-inflammation medications like steroids, prednisone will help, but they have side effects, so you can use it only for a short period of time. So that's the bulk of allergies, folks. So as I said, allergies might not present with just runny nose or cough. It can present with shortness of breath, being tired, skin rash, joint pains. It can be sometimes falsely labeled as fibromyalgia if you do not take the full history of the patient, or if you do not take the full history of the patient. So history is really important, and then you will be surprised how your life changes if we can get rid of the allergies. So folks, that was my presentation for November 2023 about allergies, which is a very common problem in medical practice. I hope this was helpful to you guys, and if you can make those changes in your life, it will improve your quality of life. So on that note, this is the end of Dr. Fazil TV show, and ladies and gentlemen, we'll be back next month with another useful topic for you guys, and have a nice rest of the month. God bless you, God bless America, and I'll be back. Thank you, Dr. Fazil TV show.